I'm sharing 5 minutes of my time with Deputy Sean Sherlock. Firstly, I want to compliment my colleague Deputy Duncan Smith for his long advocacy of home care workers and home care support and for tabling this motion. Minister, there is no member of this House who has not struggled with difficult cases from constituents desperate to continue living at home or for families desperate to have loved ones come home from long-term hospital care, only to be told again and again that there is no home help service or what is available is inadequate to allow the loved one to be treated at home or to remain living at home. The unfolding disaster of next year's health budget, a clear showdown between the Department of Health and the Department of Public Expenditure, where trust has quite frankly broken down, and the funding minister in Department of Public Expenditure and Reform has clearly and publicly signalled that he simply doesn't accept the costings of his colleague, the Minister for Health, and has therefore underprovided for health care for next year. This power play will make a difficult situation that exists at present, that the Minister has acknowledged, immensely more difficult next year. The 5,300 healthcare support assistants employed right now by the HSE cannot meet current demand. You know that. And giving people 30 minutes of home support is wholly inadequate. And further recruitment to that cohort of 5,300 is now embargoed. It makes no sense. It makes no sense to keep people in acute hospital beds when they want to be at home and when, if the resources were there, they could be at home. Meanwhile, the HSE are contracting in 13,000 or so home care workers from private providers at enormously more significant cost. The whole thrust of Sláintecare, Cathaoirleach, is the creation of an integrated, single-tier, universal public health system. The direction of travel of government is to increase dependence on private providers for nursing home care, for home support care. Less than 40% of home support is now directly provided by the HSE, 60% privatised. The basic philosophy underpinning the agreed all-party approach to the provision of healthcare in this country, Sláintecare, the health system of the future, is being systematically undermined by government policy. The increase in funding for home support next year is 0.4%, less than half of 1%, at a time when inflation, not to mention wage inflation, is expected next year to be in excess of 3%. And you add that to an ageing and a growing population, and you know what is now inadequate will be grossly inadequate provision next year. The CEO of the HSE has said, in essence, that he's going to produce a service plan to meet projected need. I've never heard any head of any state agency say he is going to provide for a deficit, in essence, to ignore the inadequate budget that has been provided because it is so patently inadequate. This is extraordinary, and an extraordinary way to run our most important public service. We need to produce the long-promised statutory underpinning of home support. The Minister has referenced it today. The programme for government promised this, but we still await its introduction. Such a vital service can't be run in such an ad hoc manner where location, availability of staff determines whether you can be provided with an essential public service or not. We wouldn't tolerate that in education, for example. Why would we why would we not demand the same level of support for our elderly as we do for our young? We've had a cross-departmental strategic workforce advisory group, as the Minister has set up. It has made recommendations. But as my colleague Jed Nash has so clearly said, the most fundamental is to have a joint labour committee to determine proper pay across public and private that will ensure that there is proper recruitment. Our health service has grown in an unstructured way Public health, voluntary health, private health. The strains on this disjointed service have long been recognised. Different terms of pay, different types of service, geographical inequalities. We had hoped we would resolve that now. Minister, in terms of home care, you can do that if you accept these motions.